My name is Stacie Klosterman. I live in Brookings. We moved here a year ago, and I am a stay-at-home mom. We have three girls, two college girls and a senior in high school. What brought me here was an ankle injury. I was running through an airport trying to catch a flight. We had 5 minutes, and I was wearing sandals. I took my sandals off so I could run faster, and we made the flight, but by the end of the night, my foot hurt. I could hardly walk. I felt confident staying in Brookings because when I first injured my ankle, I Googled, who fixes feet? And I researched a lot of doctors here in Brookings and also in Sioux Falls, and Dr. Nephi Jones stood out. I read his reviews. They were all great. A lot of people mentioned his care is wonderful. He's very patient. He's never in a hurry. And he doesn't right away go to surgery as the fix. He tries to fix things before going that route. And I just felt he was the perfect doctor for me. And also living in Brookings, I didn't want to travel to Sioux Falls or anywhere else for care. Oh, Dr. Nephi Jones was wonderful. He walked in, he shook my hand and looked me in the eye and asked me a lot of questions. He made me feel very comfortable. He took his time. I had lots of questions. He answered all of them, and he was very knowledgeable about my foot and what he felt was wrong with it and what steps to go through moving forward. What we tried first was walking boot. I was supposed to wear a walking boot for 30 days, rest it, elevate, wear a compression sock, ice. And I took a lot of ibuprofen. I was supposed to just take it easy. But by the end of the 30 days, the pain was still there. Nothing seemed to be working. He thought there may be a tear, but without an MRI, he wasn't sure. For insurance purposes, I think you have to start with small things to see if you can fix the issue, and so that's what we did, but it didn't help. For the MRI process, when I first walked into the building, the receptionist greeted me, and the waiting room was wonderful. It was big. There was a nice big screen TV and a fireplace, and it just felt very comfortable. I was nervous. I had made sure I didn't have any metal on, and my tech made me feel very comfortable. She said, "No, you're good. You're going to be fine. Once we open the door and you go in the room, it'll be just fine." So it was great. She helped me on the table. She made sure that I was very comfortable. She put a pillow under my legs to make my legs comfortable and a warm blanket over me, and she just made the whole experience comfortable. She was very calm. I think it was about 20 to 30 minutes. It wasn't bad. My tech, she was wonderful. She said, "Would you like to listen to music?" And I said, "Yes, that would be great." And she said, "Well, what kind?" And I said, "Country." And so she gave me some earplugs to help with some of the background noise from the machine. And I probably went for 10, 15 minutes, and then she came on like a speaker and checked in on me and, "Hey, are you okay? Is everything good?" And I said yes. I was very comfortable with the pillow and the blanket. The MRI showed what Dr. Nephi Jones thought, posterior tibial tendonitis, and it had a tear. So it was no longer just, "Hey, I think it's tendonitis, may have a tear," but now it's, "Hey, you have tendonitis and there is definitely a tear." So I found out I had the tear, and I knew that with time it wasn't going to get better. I had a follow-up appointment with my doctor, and he just looked at me and said, "I think we need to discuss surgery options." And I was there. I was done with the pain. I just wanted it fixed. And knowing that I had the results, it showed the tear, surgery was my fix. So I was thankful I had an answer. I had surgery February 10, and things have been great since. I've been in my walking boot. I was non-weight bearing for the first 4 weeks, and just last week at my follow-up appointment, my doctor said I could start putting weight on it. So it feels like I'm starting to get my life back. I'm able to walk with crutches. I'm able to go slowly up the stairs to do laundry or any cleaning I have to do on other levels, and Dr. Nephi Jones feels that with time I will make a full recovery. It's just going to take time. I would say listen to your doctor, do as you're told. Don't think that with time you can fix it, because with time, sometimes it can go the other way. You can actually make the injury worse, and you don't want to do that. It just feels that everyone here at Brookings Health loves their job, that it's not a job to them, it's a passion, and you feel it. When I walk through halls to go to an appointment, everyone is saying, "Hi, how are you? Can I help you? Can I point you in the right direction?" Brookings Health has a culture here that is not felt elsewhere. There's just something special about the staff here, and I've just truly enjoyed coming here. I feel like I can just pull up to someone's desk and just have coffee with them, because everyone is just so nice and friendly. And whether it be at the clinic, the hospital, Avera Therapy right next door, everyone is just very kind and helpful and knowledgeable about their position, and I'm just thankful to have Brookings Health here in Brookings.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.